Good evening. I'd like to thank all of you for giving me the opportunity to speak to you tonight. I know that most of you have older parents to help take care of. What I'm going to go over tonight is I'm going to demonstrate how to take some vital signs and how this could benefit your parents. I got a volunteer here to come up and sit down with me, be my patient. Ms. Salmon? What are vital signs? Vital signs are the basic measurements of your body's function. They consist of heart rate, respirations, blood pressure, and temperature. First thing we're going to talk about is the heart rate, or the pulse. You can feel the pulse on either side of the neck, here, on the inside of the elbows, or on the wrist. Take these two fingers and apply light pressure, and you can feel it's like a thump. And how you will take the pulse, you will hold it, and you can either hold it for 60 seconds and count each thump, or you can do it for 15 seconds and multiply it by 4. Another area of the pulse that's pretty important, especially if you have an older parent that's on the ditch, will be the apical pulse, which is right on the chest at the heart. The apical pulse is important if someone's on ditch, because if their pulse is below 60, you wouldn't get their medication to them that morning. Because what the digoxin does, it slows down the heart rate to allow more forceful contraction, so you have a more efficient pump with the heart. And with the apical pulse, you actually listen to it for a full 60 seconds. Next vital sign we're going to demonstrate is temperature. There's several ways to take a temperature. You can do it the old way, with the glass thermometer in the mouth or rectally. You can use the digital thermometer in the mouth, the digital thermometer in the ear, or the temporal scan that's become pretty popular now, where they go across the forehead. What we're going to use is the digital ear thermometer. It's pretty accurate. It actually is just a little bit less accurate than the rectal thermometer. The rectal temperature is your true body core temperature. And the way you do it, you usually lift up, back, and then you'll hear a beep on the thermometer once it goes off. She has a temperature of 99.1 right now. According to the AMA, average body temperature can run anywhere from 97.9 degrees to 99 degrees. At 99.1, it probably wouldn't be too terribly of a big deal, because it's a little bit warm today. Next thing we're going to talk about is respirations.
Happy birthday.
Respirations is basically how many breaths per minute that you're taking. How we will watch her chest rise and fall. Respirations average anywhere from 12 to 20 respirations per minute. Anything below 12 we'd be concerned at being too low, and anything really between 20 to 25, anything above 25 we'd be worried about it being too high and the patient possibly hyperventilating. We're going to cover a lot of information on blood pressure. Blood pressure is measured with a blood pressure cuff and a stethoscope by a nurse or other healthcare provider. Or hopefully you guys will feel comfortable enough to do this after we're done. Blood pressure basically is the force of blood pushing against artery walls. Each time the heart beats, it pumps blood into the arteries, resulting in the highest blood pressure, which is systolic blood pressure. When the heart relaxes, that's when you get your diastolic blood pressure. It's important that you know that one person cannot take their own blood pressure unless they're using a digital blood pressure cuff. There's two numbers that's recorded when you take blood pressure. It's systolic and diastolic blood pressure. The systolic will be the top number. Your diastolic will be the bottom number. Your blood pressure is recorded as MM, which stands for millimeters of mercury. Some basic guidelines for blood pressure. According to the AMA, high blood pressure in adults is considered a systolic of 140 or greater and a diastolic of greater than 90. Pre-hypertension is 120 to 139 systolic and 80 to 89 for diastolic. Normal blood pressure is considered 120 systolic and less than 80 diastolic. It's important to remember that these numbers can be used as a guideline only because there are several things that can affect blood pressure. Stress, where a woman's at in her menstrual cycle can affect blood pressure and temperature. The amount of fluids and food that they've ate that day. And some people get so caught up on the high blood pressure, but it's also important to remember that low blood pressure is bad also. The blood pressure is pretty simple. When we talk about finding the pulse on the inside of the elbow, what you want to do is you want to feel for the pulse. Once you feel where the pulse is at, you'll place the blood pressure cuff on. On the indicator, it's broken down into tens. So you want to make sure that your valve is turned all the way to the right. Put the stethoscope on, find the pulse again. Start pumping the valve. Once you get up to like 190, 200, you turn the valve the opposite way. The first noise that you hear will be the diastolic pressure. When you can no longer hear the thumping sound of the heart, that's your diastolic pressure. And by the way, ma'am, your blood pressure is a little bit high this evening. Do you normally have hypertension?
No.
Maybe you ought to go see your physician because it's a little bit high this evening. Might ask yourself, how is this important? If you're recording your parents' vital signs when you're providing care, and what I mean by recording them is you're writing them down on a piece of paper every day. And you want to do it relatively the same time every day so you have consistent readings. When you take your parents to a doctor, this can help diagnose high blood pressure or if they need to cut the blood pressure medications back. And while we're talking about improving the quality of health care that your parents receive, in light of the H1N1, aka swine flu, it's important to remember hand washing. With older people, influenza can hit them pretty hard. And basically, if you have any questions, the handout you guys received should answer them. And hope you guys kind of get a better understanding now of how little bits and pieces of information really improve the quality of healthcare. Thank you.